Looking at the Nigeria health sector, especially after the COVID-19 pandemic, the sector has made progress with various government interventions, projects, and policies that are now in place. However, there's still a wide gap, like there's still a significant gap in providing quality and adequate care to its citizens.
I was registered at Maitama District Hospital, but because it's a general hospital and obviously a lot of people troop in there, so at times you go the queue to see the doctor, like the queue before you even get to see the consultant. Sometimes you spend the whole day there, and the queue is just long, and so for those reasons I feel like, I just need to find a hospital that I could easily and quickly be attended to.
I want to dramatize, I want to listen. Catastrophe has come. The marcation of bounds of existence. Have we no remedy to offer to scare all the rashes? Oh, shame on our breath. I use the word shame on our breath. You know why? Because Nigeria is a shame. Right from when we got our independence, 1960, we struggled for independence. It has been shame, 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 shame.
The bad experiences I had was when I was treating my dad back in Jos, the university teaching hospital there. Sometimes the attention you needed is not given, and it's like nerve stepping, like it's not encouraging.
You can go to hospitals. It's a common problem that they don't even have a standard lab to do some scan, some tests. They have to refer you outside to private labs and also to get attended to. So to me, that's a great challenge.
Yes, the lack of staff is there, and the lack of medical facilities is there. Everybody knows that. There are some sickness you cannot treat them in this country. You understand? And there are some level of sickness as a poor man. Once you are in that condition, you just give up.
Now let me ask you a question. What sector is actually working in Nigeria? If I may ask you. Which of the sectors? Is it the is it the educational sector? Which of the sectors is actually working? So a doctor being, but that is just an old story, because we expected things like that to happen.
And in the health sector, funding has been a major problem. Funding is a critical issue. And thinking about funding, it directly impacts the sector's ability to address underlying issues. Like when we're talking about underlying challenges, we mean inadequate equipment, poor infrastructure, personnel shortage, the need for technology and innovation, epidemic preparedness, and so many other things. Funding is very important to address these underlying issues. Unfortunately, Nigeria still struggles to allocate sufficient funds to the sector, falling short of the Abuja's declaration recommended 15% of annual budget. And WHO also recommends 15% of the national budget, but it's still the same old story. Nigeria has not been able to meet up to these recommendations.
What's the essence of traveling abroad, gathering money here and there to go look for medical support, for maybe medical solution abroad, if we can have our say? It's not as if we don't have the resources. It's such a blessed country. It's just that we are unfortunate to be blessed with the kind of leaders we have.
In spite of the fact that I don't want to discredit what it's been done in the hospitals or what the health professionals are doing, but it's almost a common problem. Our health system in the country is terrible. Like I said, sometimes you go to the hospital and as if, honestly, there are some doctors and even the practitioners there that careless. It seems as if they're careless about their problem, or maybe they have a lot of people there. And secondly, I think we don't have the best facilities sometimes to attend to, some of our problems.
So concerning my latest report about the poor state of the oldest hospital in Lagos State, the report reflects the trend of underfunding in the Lagos State healthcare sector, and not only in Lagos State, across Nigeria. So as Lagos being the Nigeria's commercial hub and center of excellence, one would expect better. Like the oldest hospital should, have attained a level of standard, But then the reports reviewed pressing issues of poor maintenance, inadequate equipment, staff shortage, underfunding, and also lack of transparency in procurement.